I want everyone to imagine that you came in and you turned on the television and the news stations are telling you about a serial killer that is on the loose. And this serial killer has attacked 140,000 people. And he has killed over 50,000 people. He doesn't care if you are male, if you're female. He doesn't care if you're black, if you're white, if you're Asian, if you're Indian. He doesn't care if you live in a gated community or if you live on the streets. His only preference is that he tends to attack people who are age 50 and older. This attacker is real, but this attacker is called colorectal cancer. And I've had 3 people in my family be attacked by colon cancer. My uncle was attacked, my father-in-law, and we lost my mother-in-law 4 years ago to colon cancer. Dr. Pete Damana, he has a book that's called An Individual Plan for Treating and Preventing Cancer. He tells us that there are 133,000 new cases of colon or rectal cancer every year in the United States, and that there are 55,000 related deaths to colon or rectal cancer in the United States each year. The sad thing is that colon cancer and rectal cancer is one of the most preventable and one of the most treatable cancers that we have. But yet it is still the 3rd most deadly. It comes right behind breast cancer and prostate cancer. I'm going to tell you some signs and symptoms, and this is only some of them. Some signs and symptoms are changes in your bowel movements, blood in the stool, and this occurs because polyps and cancer in the intestine have a tendency to bleed, weight loss, abdominal pain, constipation, diarrhea. Most of these symptoms can easily be mistaken for less serious medical problems. So a lot of times people overlook these signs and symptoms until they get to the point that they are so painful that they have to make a doctor's appointment. And unfortunately, by the time signs and symptoms of colon and rectal cancer become obvious, usually it is in the late stages. There's a website called BeSeenGetScreened.com, and they try to bring awareness to colon cancer and the importance of having colonoscopies done. And they tell us that at stage 1 of colon cancer, that after 5 years, there's a 94% survival rate. In stage 2, and at this stage, the cancer is still contained within the colon, the same as in stage 1, there is still an 82% chance of survival rate. At stage 3, the colon cancer has went past the colon wall and into surrounding lymph nodes. And at this point, there is still a 67% chance of survival after 5 years. But when you get to stage 4, the cancer has went through the colon walls, probably into surrounding lymph nodes, and into tissue or organs. And at this point, the survival rate is only at 11%. So I hope you can kind of see the importance of early detection of colon cancer and rectal cancer. Dr. Mark Stokes has a book that's just simply called Colon Cancer, and he writes that early detection of colon cancer can be cured, and most importantly, it can actually be prevented. So how can you prevent colon cancer? Well, by simply going and having a colonoscopy done when your doctor recommends. The American Cancer Society has a book called Informed Decisions, and in this book, they tell us that 90% of all colon cancer and rectal cancer patients are usually age 50 and up. So most likely your doctor is going to recommend at age 50 that you start having a colonoscopy, unless you're at a higher risk, and then he would probably recommend that it would be younger. No one is excited about having a colonoscopy done. No one wants to think about you sitting on a table or laying on a table and having a scope stuck up your you-know-what in front of some doctors and some nurses. But the colonoscopies of today are far more advanced than they were in the past. Now when you have a colonoscopy done, you're sedated. You have no memory of the procedure at all. And it has a camera at the tip of the scope. And this high-definition camera can find tumors the size of a pinhead. And there's no discomfort, there's no pain associated with it. And also the removal of polyps are done during the colonoscopy. So polyps that are left inside the intestine often turn into cancer. over years. But with the removal, that is the prevention part of the colonoscopy. But if they are not removed, they could turn into cancer and go from this to this. So Dr. Nita Ahaya and Brenda Nettles has a book that's called A Guide to Colon and Rectal Cancer. And in this book, they inform us that 95% of all tumors are found during a colonoscopy. So I hope you can kind of see the importance of having a colonoscopy done and understand that even though it's not on your top 10 list of things that you want to do, it should definitely be on your top 10 list of things that you need to do. An ounce of prevention is worth a pound of cure in this case. And I hope that it has encouraged you to tell your family and encourage them to have a colonoscopy done. And if you're at an age that you need to have one done, that you will also. Thank you.